Third degree heart block. Let's go. Third degree is also referred to as complete heart block. And the reason for this is because the atria and ventricles are no longer communicating with each other. There's complete disassociation between the atria and the ventricles. And we remember this by saying if the P's and Q's don't agree, then you have a third degree. A few more characteristics. There are going to be more P waves than there are QRS complexes, and this is because the atria are going to be beating at a faster rate than the ventricles. There's not going to be any consistency of the PR interval. Again, no communication between the atria and the ventricles. Also, there may be P waves hidden up inside QRS complexes, up inside T waves, wherever, but your P waves are always going to march out and your QRS complexes are always going to march out. But there's no association between the P wave and the QRS complex. So the rate in a complete heart block is going to be slow. However, it's going to depend on one or two things. Remember that electricity is always initiated in the SA node. Then it travels down through the atria, then reaches the AV node, spreads out through the bundle of His, and then the Purkinje fibers. However, we have complete disassociation between the SA node and the AV node in a third degree heart block. So the AV node and the Purkinje fibers are thinking, hey, I'm not getting any electrical impulses here. So one of the other, either the AV node or the Purkinje fibers, are going to have to kick in as that backup pacemaker because they are thinking that the SA node is not doing its job. So the intrinsic rate of the AV node is 40 to 60, whereas the intrinsic rate of the Purkinje fibers is 20 to 40. So the rate, if we have a junctional escape rhythm, meaning that the AV node has picked up as our backup pacemaker, the rate will be between 40 and 60 because that's the intrinsic rate of the AV node. However, if our Purkinje fibers pick up as the backup pacemaker and we have a ventricular escape rate, our rate is going to be slower between 20 and 40 beats per minute. So this is a horrible illustration, guys, but in my drawing, I tried to do my best to make sure that my P waves marched out. And so you see that the P waves are totally marching out here. And our QRS complexes are totally marching out. So your P waves are going to march out and your QRS complexes are going to march out. But there is no communication between the P waves and the QRS complexes. So the most common underlying cause for a third degree heart block is going to be death of myocardial tissue, typically a big O anterior MI. As far as treatments, these patients do not pass go. We do not mess around and give them atropine. Atropine is not going to work for a third degree heart block. We have got to pace them transcutaneously until we can get them to the cath lab to put an implant and pacemaker into the patient. I hope this has helped. Follow for more. Go Vols.